So I thought we can talk through a post-surgical knee patient of mine
Hmm.
that I think we may have actually talked about before,
Hmm.
but we have a little bit more information, a little bit more on what's been going on. Just a brief
Hmm.
kind of summary. Beginning of this
Hmm.
year, middle-aged man in generally good health, relatively active soccer player, had a knee replacement. After the knee
Hmm.
replacement, upon the checkup with the surgeon, the range of motion was not where they wanted it to be. They attempted to do a manipulation under anesthesia, but under anesthesia, the surgeon kind of told him there really wasn't any manipulation necessary. Once he was under anesthesia, the range of motion was pretty much there. But when he came out of the
Hmm.
anesthesia, the range of motion was
Hmm.
consistently decreased. He's done
Hmm.
PT for 8 to 10 months at another clinic with no real improvement. And that's when he presented to my office about 2 months ago. I saw him and have been treating him. And initially, he had some low back issues that I thought could have been contributing to what was going on. I treated his low back concurrently with his knee using DNS principles and our integrative assessment approach. And he really, really liked what I was doing. He felt that he was improving. I was showing some signs of improvement, but ultimately it was a complicated case. And I wanted to make sure that we were kind of moving in the right direction and also just get
Hmm.
a second set of eyes on him. So I referred him to the man, Robert Lardner. So let me know, Robert, what you think and how I think you've seen him a couple times now, and I'm still treating him
Yes.
kind of concurrently with you. What do you think
Yes.
is going on?
Well, when I saw him, one of the things that struck me is that the knee still looks as if it was freshly operated on. It still has the that look of being swollen, a little warm. And I told him, I said, your knees should be like a dog's nose, cold. They should not be warm at all. And he laughed because knees should be cold to the touch. They should not be warm. I said, so it looks as if you have an ongoing irritation or inflammatory kind of a process. It is not the kind that is giving you a red, big swelling and edema, but it is still there. And what is also significant is that the tissue is tough. It doesn't move easily. So even if you loosen it, it's still as if you are dealing with like dough. It
Yeah,
just pulls and pulls. It is really it just draws out. It doesn't relax and let the knee bend. So
I
there
guess
is a there.
question for you though, right? With that, even for my own for everybody's
Mhm.
information, for my own information, when you say like that doughy feeling, this not letting go
Mhm.
feeling, are you
Mhm.
referring to the palpation of the tissue itself or the way the knee range of motion feels as you're trying to flex, extend the knee?
The as I try to flex and extend the knee, it is really um, there's a great resistance within
Yeah.
the
Yeah.
movement.
Okay.
Great resistance with, and throughout, not even just from when you get to end range.
Mm-hmm.
It's just like a very tight joint that won't move.
Yeah. Yeah.
And
It's to me, it's like almost like half solidified cement. You're kind of just
that's
pushing
right.
against something the whole time,
Yeah,
even
you're
though the
always
patient
pushing. It's
isn't
like a
necessarily
piston.
active. Yeah. Yeah. Yeah.
Yes,
Like a
it's like a
piston.
piston. It
There's
will not
resistance.
just move. There's resistance in either direction. And once you've moved it if, into flexion, then extension becomes difficult to get. If you move it into extension, then flexion is difficult to get. So um, I treated his back. I continued with the treatment of his back, which you had started with, and that helped him free up the sensitivity that was around the lower extremity, around the knee, and up into the thigh and into the hips, etc. So that has improved consistently. He's much better. The low back is stabilizing, and he is incorporating exercise and the stabilization according to DNS principles, etc. However, the knee is a different matter. As I feel that he has a chronic uh, a chronic reflexive withdrawal response. He wants to pull away from the knee, and in so doing, the muscles seem to be hypertonic. Um,
Yeah,
However,
true hypertonicity. It's true neurologic.
yes, and the deep fascia, the periost, is extremely sore. At surface touch, he can tell you there's no pain. But if you go deeper, it just becomes exquisitely and excruciatingly painful for him. So the deep tissues around the femur, around the tibial plateau, the fascia, the connective tissue is very tender and very and doesn't is not at all elastic. So we've been trying to work on that. My initial suspicion, and one which I still harbor, is that he is somehow allergic to some component of the prosthesis.
Right.
I
You
have
had
asked
mentioned
him
this to
for
me.
the information as to whether the prosthesis was glued in or whether it was, if it was cemented in or a non-cemented prosthesis. So I'm waiting for him to get me the surgical report because it's important. Hypoallergenic and allergenic are
Yeah.
two different things. And some people are allergic to certain metals, even if they are considered pretty neutral metals in themselves when it comes to allergies.
Yeah.
And
And I mean, it's
so
similar to the person with the, I mean, I always use the example with patients. It's like, yeah, you might not be allergic to a peanut where if you lick a peanut, we got to go to the emergency room. But if you
mhm,
eat a bag of peanuts, you might be a little swollen. You might have a little bit of an upset stomach and you
mhm,
don't realize that
mhm,
you're sensitive to
mhm.
peanut. You might,
That's right.
so exactly the same thing. He could have a very, very
Yeah.
low grade hypersensitivity to something, and
Yes,
now that it's
some
been in there
part.
for 12, 11 months, it's just
Yeah,
constantly
yeah.
reactive.
Because the tissue seems to react to the presence of the prosthesis. Um, there is no, it seems like an ongoing, I shudder to you, a rejection of the prosthesis
Hmm.
because the tissue all around locally is so tough, tight, and painful. And then the rest of the tissue further away is not. So
He had always
I've
struck
asked
me.
him,
Yeah.
go on.
I was just gonna say, in one sense, examining him initially, kind of globally, he had always
Mm-hmm,
struck me as a little bit hypersensitive in the
mm-hmm,
tissue, in touch. I
mm-hmm,
touch his
mm-hmm,
shoulder, his opposite
mm-hmm,
shoulder, and he jumps and
mm-hmm,
jerks away from me a little
mm-hmm,
bit.
mm-hmm,
Not that it was overtly painful, but it was just
mm-hmm,
a little just sensitive to touch.
mm-hmm,
And
mm-hmm,
almost like like you're explaining, it's almost like a post-traumatic disorder from the
mm-hmm,
surgery
mm-hmm.
that something is. It is. That's why I sent him to you. It's a little bit more complicated than typical.
Yes. So I think that there are two or there are three things. One is to attempt to desensitize the deep fascia and see if that will allow it to restore motion to the prosthesis. Because There's nothing wrong with the prosthesis. It is biomechanically correct, so it should give the full range of motion.
Right.
However, the arthrokinematics are quite limited. There's very little rotary ability, so that the internal rotation of the tibia that should go with flexion and the external rotation that should go with extension is minimal at best. And even if you try to restore it, you will succeed on the visit, but the next time it is exactly back where it was. There's no progression from treatment to treatment. So this is an interesting case, but I don't believe it is uncommon, but it is not that uncommon. I have met other patients who've had problems like this with no real solution in sight because no one actually entertains the possibility that they are somewhat allergic to the
When you
prosthetic
mention, if
component.
you enjoyed this conversation and want to hear more like it, then please like this video and subscribe to our channel. You can also stay up to date on our latest seminars on our social media pages on Instagram and Facebook at IMTR Seminars.